Hi, everyone. My name is Rachel Warner. I am the Executive Director of the Leonard Davis Institute of Health Economics. Thank you so much for joining our seminar today. We are very pleased to co-host this panel with Health Affairs. This is being done in conjunction with their special issue entitled Tackling Structural Racism in Health, which just came out this week. With that, I want to introduce our panelists and get today's session started. Our first panelist is Shekinah Fashaw-Walters. She is an assistant professor at the University of Minnesota School of Public Health. Her research focuses on understanding inequities in aging while elucidating and explicitly naming racism as a fundamental determinant of health inequities. She is the author of the jumping off point of today's seminar, an article called Proposing a Racism-Conscious Approach to Policymaking and Healthcare Practices, which was published in this month's issue of Health Affairs. Rakaya Yerby is the Kara J. Trott Professor of Health Law at the Moritz College of Law at the Ohio State University, where she also serves as professor at the College of Public Health. She is also co-founder of the Institute for Healing Justice and Equity and one of the co-founders of the Collaborative for Anti-Racism and Equity. She also served as an advisor on this month's Health Affairs issue. Reynard Washington will be joining us momentarily, though he's not with us at the moment, but he is the director of the Public Health Department for the Mecklenburg County, North Carolina, where he is responsible for managing all public health and environmental health activities in the county. He previously served as the chief epidemiologist and deputy health commissioner for the city of Philadelphia, and as a health research scientist for the U.S. Department of Health and Human Services Agency for Healthcare Research and Quality. And today our panel will be moderated by Athene Venkatramani. He is an associate professor here at Penn in the Department of Medical Ethics and Health Policy, and he is a general internist. He's also the director of the Opportunity for Health Lab. His research focuses on the life course origins of health and socioeconomic inequality. Athene, I will now turn the panel over to you.
Thanks, Rachel. Really excited to be here for this panel. There's been increasing interest around advancing health equity, though racial disparities in many outcomes still persist. And the key challenges seem to be really formally defining what is meant by health equity and then operationalizing that definition into action. So today we're going to be talking about that. And we're going to undergird this discussion around a new paper by Dr. Shekinah Fashaw-Walters, which talks about a new concept, racism-conscious policy. So we're going to delve into that and what it means for practice and how it might inform our efforts to achieve health equity going forward. So Shekinah, I'll start with you. Thank you so much for your paper. And so you advocate for something that's new, racism-conscious policy, which is distinct from race-neutral approaches and race-conscious approaches. Can you tell us a little bit about how those other approaches fall short and what your new proposed approach of racism-conscious policy seeks to do?
Absolutely. I'm happy that we're starting here. And first, I'd like to acknowledge my thought partner and co-conspirator in this work, Dr. Sydney McGuire, who's at Indiana University. And within our paper, we consider these three types of policies: race-neutral policies, race-conscious, or what we refer to as race-based policies, and racism-conscious policies. And we talk about how these policies sort of fall along a spectrum that moves from equality to equity, where race-neutral policies fall closer to the equality side of the spectrum. That really is everyone gets the same thing for the same outcomes, ideally. And then racism-conscious policies, which lands closer to the equity side, which really says folks are getting what they need for the outcomes that we most desire to see. And race-conscious or race-based policies sort of fall in the middle. I think before I sort of dive into describing these, I also want to note that this framework that we built out, ideally, we think it works for policies on all levels, from big P policies down to organizational policies or practices. We also will refer to policymakers often throughout the article, maybe also conversation. And so I want to note that when we're talking about policymakers, we're not just talking about elected officials. We're talking about everyone from legislative staffers to activists to researchers in the policies we propose in our papers to healthcare administrators. So just bearing those things in mind as we so a race-neutral policy are policies that attempt to improve quality and outcomes for everyone, regardless of race. Don't consider the potential and truly inevitable role that racism or even race plays in policy outcomes, or even more upstream in policy choices and the policy environment. Race-neutral policies are really in the colorblind racism, and colorblind racism uses non-racial factors such as income to explain racialized differences. But those racialized differences that we see, we don't take into account that those non-racial factors also have hints of racism manifesting within them and the differences that we see across them. Race-neutral policies are guided by the idea that all, and as such, race and skin color do not matter. And although we believe this today, and we can go back and forth on what the evidence of this is, although we believe this today, this was not always the case in our country. And so this policy type falls short in the fact that it doesn't consider contemporary forms of racism. And at best, it maintains the disparities that we see. And at worst, sometimes we see that it exacerbates this. So we don't use the term race neutral to imply that there are no racialized impacts of these policies, but on the contrary, we might see many racialized impacts of these policies. The other type of policy we're talking about today are race or policies. And these intend to improve quality and outcomes, not for everyone like race neutral policies, but explicit for or racially or ethnically minoritized groups. Am I freezing for anyone? I just got a notification that my internet is unstable. Great, this hasn't happened in a while. You hear me? Should I go off camera? Would that be better?
Yeah,
okay.
why don't we try that?
Okay, yeah. Sounds good. Sorry about that. So let's see, these race-based or race-conscious policies intend to improve quality for everyone, or don't intend to improve quality for everyone, but instead explicitly for one or more racially or ethnically minoritized groups. And they can be effective in their intent to improve outcomes for one particular group. But as Dr. Yerby might be able to speak to a little bit more, the 14th Amendment prohibits race-based discrimination. And because of that, any policy that targets a specific racial group, it has a higher standard to meet in order to be considered non-discriminatory. So this is the first shortfall of a race-conscious policy. It's potentially illegal. And then if you all have been paying attention to the social side of our country and sort of the racial awakening we've been going through, these sorts of policies can also be socially divisive. And I feel like all I need to say here is college admissions, and most of everyone here would understand what I'm talking about when I say socially divisive. But I think the most important shortfall of this type of policy is that it fails to acknowledge that racism is the root cause of racialized inequities and not race. And because of the lack of this recognition of racism as a root cause, race-based policies fail to address all levels of racism, which leaves racialized groups without full recourse for the historic and contemporary effects of racism. So racism-conscious policies are guided by this idea that if historically we've used race to create disadvantage, then now we should be able to use race to create advantage. But as Audre Lorde has said, the master's tools will never dismantle the master's house. So using race to dismantle racialized inequities isn't going to work. But Dr. McGuire and I posit that if we destroy the master's tools, correctly identifying them as racism, then the master's house or racialized inequities can no longer stand. So that's what leads us to racism-conscious policies. And we see this as the way forward. Racism-conscious policies account for the role of racism in policy choices, in the policy environment, and in impact. It's guided by the idea, again, that it's racism and not race, and that addressing systemic and racialized inequities head on is what will help us to advance racial equity. It really acknowledges, names, and dismantles historic racism as well as contemporary racism, and engages and empowers the community to create a lasting change. I think as a concrete example, I will share about the loan forgiveness example that we share within the paper. So we all know that loan forgiveness was recently struck down by the Supreme Court, I think for reasons not related particularly to this concept and the example that I want to share here. But if we were to think about loan forgiveness from a race neutral policy perspective, that would be us forgiving the same amount of student loans for everyone. If we were to think about it in a race-based or race-conscious perspective, that would be us forgiving loan forgiveness specifically for particular groups, like specifically for Black people. But in the iteration that we saw that was struck down, the policy would have provided $10,000 for everyone below a specific income threshold and an additional $10,000 to those who received a Pell Grant. And the reason that we argue that this is racism conscious is because this recognizes that a disproportionate share of minoritized groups qualify for these Pell Grants because of centuries of structural inequity within this country that lead to this exceptional financial need. I'll pause there.
Shekinah, thank you for that, and both for kind of giving us the theory of this as well as undergirding it with this example of loan forgiveness, which I'm sure is top of mind still for many of us. You touched on something else, which is top of mind, and I want to turn to Ruqayyah here to kind of delve into this a little bit more. So this idea of a racism-conscious policy approach might be even more important in light of what the Supreme Court has decided around the use of race in college admission decisions, as well as the use of race in prioritizing specific types of patients or groups of patients for COVID-19 therapeutics. So can you talk to us about how these Supreme Court decisions will be felt in healthcare and what the implications are for health policy, especially as it relates to what we just heard from Shekinah?
Yes, thank you for that. So, what is important to know about the Supreme Court's decision in the Students for Fair Admissions is that it explicitly was limited to college admissions. There were questions before the court about whether you could take race into account as one of many factors in terms of medical schools, but the court did not answer that question. And so we have to rely on what the court explicitly said, which is to limit it to college admissions. But they also said that you still can use race-based programs to do away with governmentally imposed racial discrimination. And so that really connects to this theory that Shekinah put forward and her other co-author around racism conscious policies, right? Those are the policies that we want to adopt to address and do away with governmentally imposed racial discrimination. Now, the other case that you mentioned, the Roberts v. McDonald's case, that was a case brought by a Cornell professor challenging the New York State's use or discussion of using race as one of the factors to prioritize access to COVID-19. Justice Alito, in the opinion, denying certification of the case, mentioned that it would not, the reference to longstanding systemic health and social inequities would not have sufficed the state to use race-based in their discussions. So not a decision, but a discussion about the use of race. And what I see putting together both of those decisions and the 14th Amendment's requirement about equal protection and Title VI of the Civil Rights Act, which says you cannot racially discriminate, is that healthcare facilities, states, still have a legal duty to ensure that everyone gets equal access to care, which is not happening. And so, in order to address that, what they need to do is to adopt policies that ensure racial and ethnic minorities get equal access to care, get equal admissions to medical school, and continue to try to repair the harm caused by both historical and modern day racial discrimination. And one way to do that is by adopting racism conscious policies that will eliminate governmentally sponsored and imposed racial discrimination.
Rukaya, thank you so much for that. And I'm sure we're going to be delving in further in the audience Q&A into some of these concepts. Reynard, I want to turn to you. So there's a theoretical aspect of this, there's the legal aspect, and then all of this intersects in your job in the public health department with the practical aspect. So I wanted to get a sense of, in your role as a county health official, you're kind of making a lot of decisions about the allocation of resources and public health policy. How are these three types of approaching health equity policy, race neutral, race based, and race conscious and racism conscious, how do they play out in your work? And what are the practicalities that we need to be aware of to be able to leverage and deploy a racism conscious approach?
Sure. Well, thank you so much for that question, and great to be with you all this afternoon. I think the reality is for us, particularly in public health and local public health, is that we are specifically focused on making good health achievable for everybody in our community. For us, that is truly sort of the vision and definition of health equity. When it comes to the issue of race, of course, race plays into a number of aspects of how we approach our work, both in terms of how we understand patterns and health outcomes, as well as access to resources. And so when we make decisions here locally, it comes up very often that we have to, again, ensure that our programs, our actions, our policies are really not creating further disparities that we observe by race. And so one of the ways essential to us being able to even have this conversation about race in general, whether it be thinking about policies that are race neutral or race conscious, is really this notion of having data to understand differences by race. And so for us, much of our work in practice is driven by our ability to be able to determine and detect differences. And then as we think about how we allocate resources and policies that we might set up, ensuring that we do robust analysis on the potential impacts of those things to see whether or not they're going to have an effect on racial disparities, either a neutral effect or which happens in many cases where we do have, as has been discussed already, we pass policies that are for the good of everybody. And then in some cases, though, certainly and we see this happen in reality because you see, let's just say, for example, you institute policy that focuses on improving access to prenatal care. You start to see or contraception, for example, and we start to see declines at the population level and outcomes that we are hoping to see improvements in, but we don't see the gap between racial groups closing. And so for us, the practical parts of this is really the tracking and making sure that we are doing these kinds of analyses and assessments to make sure that even if we are taking a race neutral policy approach, that it's not having an unintended consequence, but also that we are actually making progress on closing the gaps. And so several other examples that I'm looking forward to discuss as we get into the Q&A, but I think globally, it is a delicate balance, and particularly being in a local government official capacity, as has already been described, really leaning into race-specific policies is challenging because it can be a double-edged sword, both in terms of trying to have an intended impact, but also could also have an unintended negative consequence or stigma associated with a group of people. And so I think there's a level of consciousness that we all use outside of the political sort of considerations, but just in general for us to be able to make sure that we're not causing harm while we're trying to do good. And so I'll stop there and then look forward to more discussion about these.
Reynard, thank you so much. it's incredibly helpful to hear what the kind of the constraints and the parameters that you're dealing with on a day-to-day basis to make policy and how that intersects with this broader approach. There are a couple of things that came out there that I wanted to kind of pull on. So Shekinah, this goes back to you, but I would love to hear from all three of you about this. So some of the foundational principles in racism-conscious policymaking that you outline in your paper involves engaging and centering the communities that are affected the most by a given problem that you're trying to solve, and then having this kind of, going back to Reynard's point about data, continuous and ongoing evidence evaluation and policy analysis. Both of those things are really hard to do even in a vacuum. And so at the level of a policymaker, I'd be interested to hear how you imagine that working. And I think all of you, I'd love to hear an answer for this. And the second part of this is intermittently, there's equality of access to care, equality of outcomes. These are things that have come up in some of the answers to the questions that we've had so far. How do we actually define the objective of what we're trying to solve? Because it seems pretty critical in being able to leverage this framework. So maybe we can start with you, Shekinah, just talking about these foundational principles in racism-conscious policymaking, specifically the engagement piece and the evaluation piece.
Sure thing. And I'm going to try my camera. Hopefully it's cleared up a little bit, but if it starts glitching, someone send a chat and let me know. So I think both of those questions are well connected to one another, because when we're talking about how we define the objective of what our policies should be focusing on or what we should be pursuing, at the heart of that should be the community. And so when we're talking about continuous engagement with the community and centering their voices, we're really talking about shifting and sharing, but mostly shifting the power and the authority of what happens with our political agendas back to the people that these political agendas and policy agendas are all about. And so that's one of the reasons that we consider this a foundational principle, is because we have to have the right folks at the table. And too often the right communities and the folks that we're making these policies are are left from those tables. And then I think that Reynard spoke really well to the importance of this ongoing evidence evaluation and policy analysis and understanding what the policy is doing, whether there are unintended consequences or intended consequences, and what those look like. And I think one of the really important pieces here that I like to pull the thread on a bit is realizing that both racism and politics are dynamic and they change with time. And so the way that we see racism manifest in certain outcomes or communities is going to look different depending on the time that we're in. It's going to look different depending on the context that we're in. And so one policy that works in one area or in one healthcare setting might not work in another. And we have to be really intentional about understanding that.
Yeah, I'll jump in. What I love about the community engagement aspect of it is that it connects to the work that Professor Lindsay Wiley, Seema Mohapatra, Emily Benfer, and I have done, including Brietta Clark, around health justice. We often talk about health equity, getting each individual to their best health outcome, but health justice requires us to actually begin to address oppression and discrimination, right? And so that includes both racism, it includes sexism, ableism, it includes discrimination against those who are LGBTQIA. But what it does is center the community, and change should be community driven. And so that is key to us if we're talking about racism conscious programs or other intersectionality approaches that we can address. One thing I do want to add to this discussion, which we didn't raise initially, but I see it in the questions, is this discussion about racism and racism conscious policies and how will it impact different groups. Racism, which I talk about more in terms of racial discrimination because of my law focus, harms everyone in the US. So it harms all racial groups. It just disproportionately harms people of color. And so if we're talking about racism conscious policies, it has the potential to improve the health and the outcomes of everybody in the US, white, Black, Asian, Native American. Furthermore, what it does is it allows us to begin to break out the harm that is suffered by each group, because as Shekinah has mentioned, it could be different in terms of the harm and different in terms of the solutions, right? And so what we need to do is to be able to track the impact that this is having on individuals and groups, and be able to measure how we can begin to address those things. So that's what I would say in terms of one, it's community driven, because how are we going to get that? You can't just get it from the numbers. You actually have to talk to the community and see how it impacts them on their daily lives and how and the solutions that they think will help improve those outcomes. And we do it across all groups because, as I mentioned, racism, racial discrimination harms us all. And we could even see that in the affirmative action case. Research has shown that when you take race out of college admissions and you use legacy in athletics, what you tend to do, if we care about this, is that you tend to see the grades and all of the things that we consider important for college admission dropping, right? And so when we look at the research, we just have to be clear that these practices are to help everybody. And so if we track that and try to implement that in a community-driven way, I think we'll have better outcomes.
Okay, thanks so much. Reynard, I wanted to give you a chance if you had any thoughts to that, but also Seg, to asking you a little bit about the work that you did as a chief epidemiologist on thinking about the health of Black men and boys in Philadelphia, and how some of these principles kind of informed the work that you did on the ground.
Sure. So I would say I think it's really important. There's another really important aspect to this work that comes into play very often for us at the local government level, and that really is geography. And which is underlying sort of like construct for this whole notion of trying to be racism conscious, is that we are still largely very much segregated in many ways by race in terms of where people physically live and the concentration of people of color in certain parts of communities. And so as we think about our role as an agency to improve the conditions of where people are living, specifically thinking about this in a racism conscious perspective, you've got to acknowledge the fact that the variation in geography and the segregation by race certainly plays into our need to really be hyper focused on certain areas that lack opportunity in a number of ways, or don't have the tools necessary within their communities to live a healthy life or achieve the kind of health that we're all optimal health and have a long lifespan that we're seeking to achieve. And so for us, in a practical manner, I do think looking at the geography allows us to be racism conscious, because we're able to not just focus on the proportion of people who live in a community by a certain race, but also look at the conditions in those communities specifically and focus on those conditions. That, of course, if you were to look at the differences by race, you would see it there by race, but really it's the condition that we want to sort of target from a programmatic and policy perspective. But if you focus on those conditions, take, for example, community violence or access to tobacco products, which is an issue that we took up when I was in Philadelphia, then you are able to start to really sort of be less polarizing as it relates to the politics of all of this, but you're able to make progress as well that hopefully will start to close some of those gaps. Part of our goal as a health department in Philly really was to improve outcomes as it relates to life expectancy. And if we looked across the data related to life expectancy, Black men and boys had the lowest life expectancy of all demographics in the city of Philadelphia, and in fact made up about 20% of the city. And so from our perspective and the health department, if we wanted to actually improve the health of Philadelphians, we had to do something specifically to improve the health of Black men and boys, because that group makes up 20% of the city, and if we continue to have the wide disparities that we have. And so this really sort of teeters on this thinking about sort of race-based versus race-conscious, because again, you have this conversation about race where you really want to get a lot of energy and attention on an issue, but it can be polarizing. And so what we were trying to do really was make the case that this is for the benefit of the entire community. Progress among health outcomes, specifically for Black men and boys, is to the benefit of everybody, which I think it was just sort of mentioned earlier. And so sometimes you do have to do that kind of focused attention. And there are other examples of it where, we focus on certain racial groups because a problem is disproportionately impacting that group. And in practice, it is ultimately a balance of all three types of approaches where we have to really leverage them to be able to achieve our outcomes.
Bernard, thank you so much. And the point about addressing some of these systemic factors in ways that could be to the benefit of society as a whole kind of reminds me of some of the work by Lisa Cook, looking at the impacts of state-sanctioned violence in the form of lynchings historically on patents by Black inventors, finding that there was a chilling effect on patents. And we know that innovation can have spillover effects for everybody. So it kind of really underscores this idea that there are these positive benefits for everyone potentially on intervening, and those should be tracked. So I want to go to some of the audience questions, and I'm going to try to group these because there's quite a few. There are some questions first related to data. So these questions are asking a couple things. One, I think Chris asked about the point about in measuring different impacts or constructs by race, it might be have an unintended consequence of putting these populations at risk or be intrusive. And then Rachel asks about the fact that it's kind of something that I've wondered about too. There is this sense that race is a social construct, yet we are measuring things by that very social construct. So how do we kind of think about that in both of those things in our data collection efforts? And there's the legal, there's the practical perspective and the theoretical perspective. So curious if anyone of you wanted to jump in on this one.
Yeah, I'll start. I think it's the balance between sort of measurement by race. I said some time ago, even as an epidemiologist, that it's really important that we are mindful how we use race in analytics. It is important as much as it's important for us to use it. There is a balance, and I have seen many examples of when it was either inappropriately used or it was used in the interpretations were giving race a power that it didn't have, and it really is, in fact, some underlying differences, either geographical because of what's available in certain communities or other factors that could be driving it. And so sometimes we do a good job of including race and overusing it. And then in other cases, we don't do a great job of actually quantifying the role that race actually plays in outcomes. For example, racism and maternal care, for example, we don't do a great job of actually being able to measure that. We look at maternal outcomes by race all the time, but looking at that role that race actually plays in those outcomes is something that we still are challenged to be able to do. And so I do think it's a balance that has to be struck. And in epidemiology, we really have to talk about that balance, because I think it just becomes routine that people just do analyses by race and make interpretations without actually acknowledging the fact that race is a social construct. And there probably are a whole set of underlying factors that are tied to the disproportionate exposure of certain communities of color to certain conditions that is driving it, as opposed to the actual color of their skin.
Yeah, and I'll jump in. For me, I think it's important for us to start adding in asking people about experiences of racism. Some of the research out there has actually begun to do this, particularly in the use of alcohol and cigarettes. And what you see is that people who mark that they have experienced racism across all racial groups have higher rates of use of cigarettes and alcohol and binge drinking. So I think it is important for us to try to move away from just asking people race, because even when you ask two Black people about race or racism, they may have different answers. So you're not really collecting what you need to do, particularly if we are going to try to ensure that we are fulfilling the legal requirements of addressing racial discrimination, that we need to start asking people explicitly about things related to racism, which to me is the same thing as racial discrimination, right? And so asking them, have you experienced racial discrimination, racism when you went to the doctor? Do you feel like they listened to you? Also asking questions about their neighborhood, going back to what you said, Reynard, about geography and about segregation. I think if we are talking about beginning to address racial discrimination and how are we going to eliminate it, we need to ask people about the things that we know manifest from racism and racial discrimination. And why that's key to me is because, as I've mentioned before, and I think as Reynard so aptly stated, that when you look at a lot of the research, what you'll tend to see is you'll focus on Black individuals as the only ones suffering health inequities. But what you do, if you expand that discussion and those questions, you will see how white individuals, Asian individuals, Latino individuals, Native American individuals all suffer from some barriers. And if we're trying to eliminate those barriers, we need to figure out what they are, and they're not race. I do want to just take one other second because you asked a question, I think that was directed at me, in terms of over assessing these groups and individuals. We already do that in everything we do. And so I would rather ask them questions and then also partner with them for them to be leading and co-designing this work. I think that perhaps is the difference, is that we don't just continue to go and ask them questions. We also partner with them and ask them to lead this work, particularly around what they feel they need, because their answers may not be specific to racial discrimination. It may be specific to housing, which is impacted by racial discrimination, right? Specific to employment or insurance. But that's what we need to begin to do.
This discussion is just so exciting. I agree with everything that's been shared here, and I'm reminded of so much work that is currently happening to better measure racism, how I'm pushing my work forward in the same way of, Rakaya, there was something that you said just a moment ago about how, we need to be asking people their experiences and the manifestations of racism. I have a pilot award right now that is where we're asking older adults about their experiences with racism, which comes from my experience with my grandma when I told her something was racist, and she grew up in the Jim Crow South and said, you don't know what racist is. And so that just speaks to, once again, time period, context, generational differences, and how racism is perceived and how it manifests. And it's so important to be able to pick up on all of that. I also want to highlight that even as we're talking about sort of the barriers and the structural inequities that are associated with race and that we tend to highlight in this work, and the barriers that are faced by different racial ethnic groups, I also want to highlight that there are also assets, and that's important for us to learn from as well. So as much in this discussion as we talk about racism and its negative impacts, on the flip side, there are communities that are thriving, and better understanding why they're thriving and what's working for them. Perhaps those are things that we could dig into more to learn how to translate that to other settings or other communities.
Thank you all for that. This is such a robust discussion, and you all can continue it, or I can ask a couple other questions that are coming from the audience. All right, so maybe I'll do that. So one set of questions, I think, and I think this is good because we have a lot of people here, many of whom have had different exposure to these terms and this area of inquiry and policy making. So this is combining a couple questions here, but how is racism conscious policy making different from things that people may be hearing about in the zeitgeist or in the news, for example, such as reparations or this idea of anti-racism? I think your framework is more general and starts with a community-driven approach to the objective and goes forward, but curious how you would position it, given that there's a lot of activity in this in the space right now. And so, just trying to understand so that people can be clear what you're trying to achieve or what you all are trying to achieve, as opposed to what might be out there that they're reading.
I guess I can start us off. So I see this in many ways as being similar to some of the work that's already out there. As my co-author and I state in the article, this is really us bringing together a few different ideas and trying to shape it into something that is a bit more actionable, and still sort of on the theoretical side, but a little bit more actionable. But I think all of those concepts and ideas, all of those movements are really intertwined into this racism conscious approach. And I'd say that, this is one approach, but racism is so multifaceted and manifests in so many different ways that we do need multiple approaches to be able to dismantle it in the ways that we want to see the health equity advancement that we most desire. I'll pause there and see what other thoughts folks have.
Yeah, to me, so I would say I agree. And I would put it together with some of the other work that's being done out there. There was a discussion about racism conscious praxis in medicine, public health, and health policy. I was one of the co-authors along with Dr. Rowan Kasachi and Dr. Derek Solon. I think for me, it is all about trying to address and eliminate historical and modern day practices of racial discrimination. And so that is the crux of it. And so to me, some of the anti-racism policies and practices that are undertaken by hospital groups to ensure that racial and ethnic minorities, particularly Black and Latino individuals, get the same care as white individuals, fits in this racism conscious policy. The same thing when we think about some other work focused even on race-based policies, to me, because really what it was trying to do was trying to address the system of racial discrimination that has continued after the end of the civil rights movement, right? And so under the law, we often talk about racial discrimination, and sometimes people say that that is smaller than what we call racism in other areas. But what is actually, and going back to what you said, Shekinah, is that that actually is a misinterpretation of the law and what racial discrimination is, evidencing, again, the master's tools, right? Because when we think about racial discrimination, under Jim Crow, it was about systems, right? It was about an entire system, whether it be housing, education, employment, that was structured in a way to keep Blacks, Latinos, Asians, Native Americans out. And so when we think about this racism conscious policy, to me, it's another extension of the work that they were doing during the civil rights movement to begin to try to ensure that everybody has equal access to all the resources and rights that they are guaranteed under the Constitution. I do want to just highlight one quick thing. I had mentioned that racism harms us all, and I do want to cite to the work of Dr. Kamara Jones, who writes about that racism saps the strength of the entire society. And so as Reynard was talking about the higher rates of infant and maternal mortality for Black individuals, what we don't understand is that white individuals in the US also have very poor outcomes as well, in part because we are not willing to provide equal access to health care for everybody because of our belief that somehow we need to keep Blacks, Latinos, and others from having equal access to healthcare. So that negatively impacts everybody in this country. So to me, your question about anti-racism, racism policy, critical race practice, the work of Dr. Kamara Jones, and many other critical race legal scholars is really just to address this system of racial discrimination that continues even after Jim Crow.
Wonderful. Well, thank you all for that. think we can take maybe two more from the audience, and I'll try to summarize these, and then we can wrap up. So Caleb has a question in terms of the research side of this. Obviously, this is looking into the role of racism in patterning health outcomes is a very active and large area of research at the moment. How can this research be helpful to advancing these policy objectives? And are there cases where research can be potentially harmful? So I'm curious, actually, maybe I'll start with you, Reynard, if you're okay with this. What types of research would you need to be able to advance racism-conscious policymaking approach in your day-to-day? What's there? What are we missing?
Yeah, I think one thing that I alluded to this, I mentioned it earlier, I think understanding specifically the actual role that race plays in being able to quantify the role that race plays in outcomes that we see, or what proportion of the disparities that we observe are a result of actually race versus other factors like the social and economic determinants that might be driving a person's ability to be able to achieve health in some way. I think understanding more the role race plays and being able to document that so that we can, and also understanding people's experiences of racism, right? So it's, if we don't document what and aren't able to quantify in some manner, both or qualitatively to understand what experiences people are having as a result of their race. And this, again, is not just this is now more on the individual level, not at the community level. I think having a way to measure that would be really, really helpful. And I think what's harmful is when, outcomes or differences are attributed to race. And in fact, there's a whole host of other factors that we can specify that are also driving that issue. And then people solely point to race as the factor, right? Because I think that discounts the role that other factors that we could have that are less polarizing and we could actually intervene on are having an effect on the outcome. So I think it's important to have measurement, but also it's important to balance that measurement with other factors that could be driving whatever outcome we're measuring.
All right, I appreciate that. I actually wanted to, I know Shekinah and Ruqayyah will have a lot to say about this, but I wanted to actually pair together two other questions that I'm seeing as we get to towards the end. So this is from Juan and Margarita. Margarita is a journalist writing about health disparities and equity. And her question it was with regards to how can journalists better cover this kind of the dynamics of how racism and prejudice might affect health outcomes in ways that I think other folks in the audience have asked, how do we kind of move this conversation forward? And Juan's question kind of gets there, which is, where do you go from here? There's been a lot of discussion on achieving health equity, but in many states, there's a backlash to that discussion. Banning books, banning the use of DEI, for example. So how do we kind of advance from this? I see those two as related. How should we shape this national conversation through the way journalists are talking about it? And what might that do for what's happening in different states with regards to their proclivity to adopt an approach like this?
Yeah, I'll start. To me, I think the key is to actually be clear about what we're doing. I think much of the discussion about diversity and inclusion and banning books is ahistorical and afactual, meaning that they do not connect it to the current practices of racial discrimination. And so when we talk about this, we need to connect it to the reason we are doing diversity, equity, and inclusion is to, again, offset, eliminate racial discrimination, to ensure that everybody has equal access, right? That when we say the 14th Amendment guarantees that it actually is a reality. And so what often happens is that these stories are divorced from racial discrimination, divorced from the practices that continue in every avenue of life, as if that is somehow separate, right? And so when we talk about diversity and inclusion efforts at colleges, I think one of the key things in Sotomayor's dissent was to know how North Carolina was still racially discriminating against people. And so their practices of including race in college admissions as one of 27 factors was necessary. But the good part about it is that the Supreme Court didn't say you can't use race to address racial discrimination. It just said you can't use it for diversity. And so we need to be really clear about the things that we are doing are connected to racial discrimination, right? As Reynard said, we still see racial segregation. It's not because of policies that happened in 1960, it's because of current policies of redlining, where Black individuals, Latino individuals cannot get the same loans. They can't get in the same neighborhoods as white individuals. That continues. The same thing with education, the same thing with healthcare. So we need to connect, do a better job of connecting it to facts and stop saying just racial and ethnic minorities can't get equal access. It's because of racial discrimination.
Rukaya, thank you so much. So I'd like to pose the final question to you all, and I think it will actually address some of the questions that came up in the Q&A. I just want to thank the audience for this very robust discussion, and I'm sorry that we couldn't get to all of your questions. There's a lot in there, and I hope you all get a chance to see these questions after this is all done. But here's the final question. Shekinah, I'll start with you. What do you think is the most important thing that could help advance this approach of racism-conscious policymaking and make it more common? And before you answer that, I want to say thank you for writing such a thought-provoking article. Clearly, it is of great interest to many people.
Yeah, well, thank you all so much for engaging in conversation around this paper. This idea has been floating in my head for some time, so it's exciting to hear about how it's done practically, but also some of the legalities behind it. As a researcher, I think one of the most important things when speaking especially to the community that I'm a part of as a researcher is to really take this approach in papers where in that discussion section that maybe some people throw together at the last minute. So maybe some folks do very thoughtfully to be really thoughtful about the policy implications that we're discussing within those parts of the paper. We can take this approach and we can start to talk about them policies that CMS and other HHS should be taking, CDC should be taking into account based on sort of this more racism conscious approach. And I think I saw in the question somewhere about how this might relate to intersectionality or other groups. And we do call out in the paper that we see this approach to policymaking as more of a socially conscious approach to policymaking, that we can replace racism with sexism and other isms to say, okay, how are these things functioning structurally and what can we do about them in terms of policy? And then, also related to research is really this piece around measurement, which we've been having discussion on already. It's so important that we measure racism and find ways to do that. And there are amazing groups all over the country that are doing this work. Very early career scholars are really leading it within this area. But I would also say measuring equity. I think we keep talking about advancing to equity, but we still have yet to really solidify what that is and what that looks like. And I know CMS is starting to lead in on some of that work around how we measure equity. So I think those pieces are really important right now. Thanks again.
Thank you. And I second that notion to really have a explicit and community kind of informed definition of what health equity is. So Rukaya, how about you? What is the most important thing we can do to advance the use of this framework?
Yeah, I think just to reiterate, and I'll be quick, is really trying to connect it to the elimination of racial discrimination and moving to the fulfillment of the 14th Amendment, Title VI of the Civil Rights Act, Section 1557 of the Affordable Care Act, of our understanding that we have never gotten to that point where we have ensured that everybody in this country has equal access. And so we need to begin to start working towards that instead of working against each other, because we have enough resources in this country to be able to do that. And I look forward to us building the community that we did in the 60s and 70s, where we had the Black Power, the Brown Power movements to begin to do this work. So
thank you so much. And Reynard, we'll leave you with the last word.
Sure. I'll try not to be repetitive. I think there's a lot of really great sort of takeaways from what my colleagues have shared already. But I'll say I think one of the most important things we all can do is to continue this engagement around this issue, and engagement with amongst academicians, engagement among policymakers, engagement among community members, more importantly, and people's experience, and the engagement that's sort of bi-directional and ongoing. I think there's a need to continue this conversation. Every organization needs to be having internal discussion about sort of how, in fact, their work, policies, and programs impact race, different races, or how racism could be playing a role in the work that they're doing. And so I think continued engagement is really, really critical, in addition to the things that have already been mentioned. We've got to keep the conversation moving forward, and we've got to keep talking about it amongst all the various stakeholders I've already mentioned, if we really want to ultimately make our way towards beyond framework and theory to actual practice. Is got to have more conversation.
That's a wonderful way to end this, and I think that conversation that you want, where it's already happening right here, and there's a ton of energy around it, and I see a lot of productive questions and comments, and so this is really great. It's been a joy to do this. Thank you all so much for your time, and I'm going to turn it over to Rachel.
I will just add my thanks and say, Shekinah, thank you so much for bringing us together to have this important conversation today. And thank you to Rakaya and Reynard to join the conversation, and of course, Athene for giving us the questions so that they could engage in this conversation. I hope you all will take this conversation and continue having it as you move forward. Also, please save the date to join us at our next seminar, which will be on November 3rd, which will be around reforming Medicare Advantage to deliver on its promise of providing high-value care. Until then, I hope you all have a great day. Thanks so much for joining us.